There's a common misconception that people with kidney disease can't adopt certain diets, such as vegetarian or plant-based meals. However, recent studies suggest otherwise. When done wisely, these diets can actually be beneficial. They may lower the risk of developing kidney disease and even help slow its progression if it's already present. This is why, in this video, we'll explore the best and worst diets for reducing creatinine levels and improving kidney health. Stick with us until the end to find out if a plant-based diet or other popular diets like keto or carnivore could be suitable for you if you're dealing with kidney problems. Before we jump into it, don't forget to give us a thumbs up and subscribe to our channel for more tips on healthy living. Now, let's get started. Let's kick things off by talking about diets that are good for your kidneys and can help lower creatinine levels. 1. Vegan diet. The vegan diet has really taken off lately, and it's not just a trend. It's a lifestyle choice that's gaining popularity for ethical, environmental, and health reasons. So, what exactly is veganism? It means no meat, no eggs, no dairy, and no other animal products. Instead, vegans fuel themselves with grains, vegetables, fruits, legumes, nuts, and seeds. Now, here's an interesting twist. While our bodies naturally produce creatine, a compound crucial for muscle function, it's also found in meat. So, those on a vegetarian or low-protein diet might have lower creatine levels than meat eaters. A recent study highlighted significant differences in serum creatinine levels between vegetarian and omnivorous individuals, showing correlations between creatinine levels, lean body mass, and strength. But that's not all. Research indicates that vegetarians often exhibit lower fasting glucose levels and higher insulin sensitivity compared to omnivores. This might explain why vegetarians show reduced beta cell function, a marker for insulin resistance. The homeostatic model assessment, insulin resistance, confirms this trend, with vegetarians scoring better on insulin sensitivity measures. When it comes to kidney health, a vegetarian diet seems to play a positive role in phosphorus balance. Plant-based protein sources have been shown to decrease fibroblast growth factor 23 levels and maintain healthy serum phosphorus levels. Plus, the emphasis on grains, fruits, and vegetables in a vegetarian diet can help reduce metabolic acidosis, which could be particularly beneficial for patients with chronic kidney disease. So, whether you're considering going vegan for ethical reasons, environmental concerns, or health benefits, it's clear that a well-planned vegan diet can offer a host of advantages beyond just nutrition. 2. DASH diet. One standout is the DASH diet, which stands for Dietary Approaches to Stop Hypertension. It's a favorite among health professionals, recommended by the National Kidney Foundation and approved by the National Heart, Lung, and Blood Institute, the American Heart Association, and the USDA. This diet is packed with fruits, vegetables, and low-fat dairy products, while being low in fats, sweets, and added sugars. It also emphasizes healthy proteins like lean meats, nuts, seeds, and legumes. Why is the DASH diet so great for kidney health? Well, a 2019 study found that it significantly reduced the risk of kidney failure for people with moderately severe chronic kidney disease, especially those with high blood pressure and diabetes. The key here is its focus on healthy, low-sodium foods. Here's a tip. Aim for foods with less than 140 milligrams of sodium per serving, or go super low with less than 35 milligrams. It's important to note that if you have chronic kidney disease, you should consult with your healthcare provider before starting the DASH diet. You may need to keep an eye on your potassium and phosphorus intake. And if you're on dialysis, the DASH diet isn't recommended, as you'll have specific dietary guidelines to follow. 3. Mediterranean diet. This diet is a staple in countries like Italy and Spain, and it's all about enjoying delicious, wholesome foods. It includes cereals with moderate amounts of fish, cheese, olive oil, yogurt, and very little red meat. A 2019 study found that eating less salt, sugary drinks, and meat is linked to a lower risk of chronic kidney disease, CKD, and albuminuria. On the flip side, loading up on veggies, fruits, and whole grains, and eating animal foods in moderation can help keep your phosphorus and potassium levels in check. Cutting back on ultra-processed foods also lowers your intake of sodium, potassium, and phosphorus. The Mediterranean diet is highly recommended for CKD patients, with some tweaks based on the stage of CKD. The 2020 DOKI guidelines suggest this diet for adults with CKD stages 1 to 5 who aren't on dialysis, and for transplant patients to help with lipid control. For those with CKD stages 1 to 4, increasing your intake of fruits and veggies can help reduce body weight, lower blood pressure, and cut down on acid production. An alkaline diet, which is part of the Mediterranean approach, is great for slowing the decline in kidney function. Here's what makes the Mediterranean diet so awesome. Extra virgin olive oil is the main source of fat. It's perfect for drizzling over vegetables and legumes. Studies show it can lower the risk of stroke, coronary heart disease, and diabetes, and it also helps with some metabolic and inflammatory markers. This oil's antioxidant and anti-inflammatory powers are especially beneficial for CKD patients. Also, the high vegetable content in this diet means a low acid load, slower CKD progression, less constipation, and better gut health thanks to all the fiber. However, navigating this diet, especially with CKD, can be tricky. This is where a renal dietitian comes in handy. They can tailor the diet to your specific needs and help you confidently answer the question, what should I eat to keep my kidneys strong? 4. Mind diet. This eating plan combines the best of Mediterranean and DASH diets with an extra focus on foods that boost brain health. So, what's on the menu with the Mind diet? Green leafy vegetables are a big deal here. When we say greens, we're talking arugula, collards, dandelion greens, endive, grape leaves, kale, mustard greens, romaine lettuce, spinach, Swiss chard, and turnip greens. You should aim to eat these every day of the week. Berries are another highlight. Instead of other fruits, the Mind diet zeroes in on blackberries, blueberries, raspberries, and strawberries. Try to enjoy these brain-boosting berries at least 5 days a week. Beans should feature in 4 meals a week, poultry should be on your plate twice a week, and fish at least once a week. Nuts are another important component. You can snack on them 5 times a week. To keep your brain in top shape, the Mind diet also advises cutting back on butter, cheese, red meat, fried foods, pastries, and sweets. What makes the Mind diet so special is its targeted approach to brain health, while also benefiting overall health. It's a win-win. 5. Paleo diet. Imagine eating like our ancient ancestors from the Paleolithic era, way back when they roamed the earth, munching on game animals, seafood, fruits, nuts, and seeds. That's the essence of the Paleo diet. No grains, no dairy, and definitely no added sugars. However, here's where things get tricky for kidney health. While the Paleo diet can be rich in protein and healthy fats, it also comes with some risks. For instance, cutting out dairy can lead to deficiencies in calcium and vitamin D, crucial for bone health. Plus, loading up on meats can pump up your intake of saturated fats and protein to levels that may not be ideal for long-term kidney and heart health. There's even research suggesting that sticking with paleo for the long haul might mess with your gut bacteria, potentially raising risks for conditions like heart disease and kidney disease. Certain gut bacteria, like Hungetella, get busy breaking down compounds found in red meat, eggs, and dairy into something called trimethylamine. This little molecule then morphs into trimethylamine N-oxide, which has been linked to higher risks of kidney disease. It's better to avoid this diet and let the past remain in the past. 6. Keto diet. The ketogenic diet is a trendy eating plan that is all about low carbs and high fats, somewhat similar to Atkins and other low-carb diets. It drastically slashes your carb intake and replaces it with fats. This shift puts your body into a state called ketosis, where it becomes super efficient at burning fat for energy. Your liver also starts producing ketones, which are great fuel for your brain. A 2012 study compared low-carb, high-protein diets with low-fat diets and found that while there were slight decreases in serum creatinine levels initially, there were relative increases in creatinine clearance over time in the low-carbohydrate, high-protein diet. This means the kidneys were working more efficiently to filter waste products, which is generally a good sign in the ketogenic diet. But remember, keto isn't a one-size-fits-all solution. The keto diet might not be the best choice if you have kidney issues. This is because it is typically high in protein, which can result in higher creatinine levels. Also, a diet with a high level of unhealthy fat can further damage the kidneys. Therefore, it is necessary to monitor your health closely and consult with healthcare professionals if you have any concerns. 7. Carnivore diet. As the name suggests, this diet is all about animal products. That means you'll be eating more beef, pork, chicken, fish, and even organic meats. People on this diet also enjoy eggs and some dairy, but you won't find any fruits, veggies, grains, or legumes on their plates. However, because this diet is so high in protein, it can increase creatinine levels, at least temporarily. When you cook red meat, the heat converts creatine, found in the meat, into creatinine, which could be a concern if you're keeping an eye on your kidney health. Swapping a steak dinner for a hearty vegetable stir-fry or lentil soup now and then can be a delicious way to support your kidneys and overall health. What you can eat depends on how much kidney function you have and whether you have other health issues like diabetes or heart disease. This is why it's crucial to have a conversation with your healthcare team or a dietitian. They can help tailor a diet plan that's perfect for your specific needs. Thanks for sticking with us today. Before you run along, make sure to like this video and subscribe to our channel. Don't forget to share this video with anyone who might find it helpful. You might be saving a life.